If you have neck pain exactly at the base of the skull, right where the head meets the neck, you're in the right place because I'm going to teach you 3 techniques to relieve pain exactly in that area. And we're only gonna need a small spoon like this. Go get one and join me during the video while you get your spoon. I want to let you know that very soon, from June 30th to July 6th, the event of the year to improve your neck pain will take place. 7 days where I'll be giving you information and exercises tailored to you, just for you, so that neck pain won't be a problem. Not today, not ever. I'm just going to turn around to get into position. There's the camera, so we can be in a comfortable position. From here, I want you to start by locating the muscles that should be right in the back, from the base of the skull to the base of the neck. This whole area is full of deep muscles, especially here where it connects with the spine and the skull. For this, now I want you to first take your spoon, start with your right hand, and from here I'm going to place the cable. Better here, so it bothers me less, and from here, sweep around all that cervical musculature. Pay close attention. I'm going to use the edge of my spoon, this one right here, to scrape all that surface, bring more blood, and relieve the muscles. Yeah, you can use a little bit of oil so that the spoon slides better and doesn't cause so much irritation on the skin. I'm going to do it without absolutely anything. So what we're going to do is start right here. Right below the ear, place that spoon parallel to the skin and gently go. Down along that lateral muscle, which are the scalens. Very, very pleasant to work on. We go up, press the edge of that spoon again, and little by little we go down to the base of the neck. We move forward a little more, press that spoon again, and then lower it down to the base of the neck. And we repeat. From the nape area, we go down to the base of the neck. As far up as it can go with the spoon, as far as you want, really. But the hair starts to grow exactly there, at the junction between the neck and the skull. So it's an easy reference point to find. Although for me, it's harder since I don't have any kind of hair. We grab there, stick that spoon in, and go down slowly, slowly to the base of the neck. Let's continue. Once we've covered that whole muscular area at the back of the neck, we repeat the same thing. On the opposite side, I start from the outermost part, right below the ear, down toward the neck. I move a little further. I'm going to move across so you can see it better. I press that spoon in and go down with it to the base of the neck. I continue. I press that spoon in a little deeper. I keep going down, I keep going down, I keep going down, I keep going down to the base of the neck, and I continue. I move a little further and keep sliding that spoon down to the base of the neck a bit more. I continue until I've covered all the muscles, the whole back part of the neck. In the middle, we don't do it because here we have the spinous processes of our cervical spine, and it can end up being uncomfortable. Next, we're going to tilt the head a little to the side to put more tension on the muscle group that runs along the entire side of the neck. And we're going to focus a bit more on the trapezius. We're going to start again from the base of the ear and continue. But this time, instead of stopping here, I want you to go as far out as possible. I don't know if you noticed, but right here there's like a bump, a bone, and that bone is the clavicle. We should reach all the way there, okay? If you don't reach all the way, it's okay, but that's the goal within the movement. We press that spoon flat, add a bit more intensity, and tilt the neck well to work the trapezius muscle as much as possible. We go down until we reach the bone. We press again, more intensity, keeping it parallel to the skin. We go down, and you can see how the skin gradually becomes more and more reddish. We bring a bit of inflammation, a bit of blood, and it can be extremely pleasant for treating some muscle pain. We go down, that's 3. If it's very uncomfortable for you, if it scrapes too much, we can use a little bit of oil to make it more pleasant. 4. Last technique, spoon nail. I go down to the side. I return to the starting position, move to the side, to the opposite side. Always keep your eyes forward, remember. And from here we're going to do the same number of techniques. I'm going to move a little to the side so you can see it better. I stick that spoon right below my ear and slide it sideways until I reach the lateral edge of my trapezius, right at the level of the clavicle. I stick it in. I'll go back down with more intensity, more pressure on that spoon to work the muscles more deeply. I stick it in and go back down. That's 3. Let's do 2 more. I stick it in, go back down. Last repetition or pass, I stick the spoon in and go all the way down. Very good. We've worked on the general muscles. We've focused a bit more on the trapezius. Now we're going to focus on that underactive muscle group, which is what we really want to work on with this spoon. For that, we're going to use the edge of the spoon. Look, I want you to use this part, just the edge or the tip of the handle. And I want you to apply a little pressure right behind the process. Mastoid. If you feel with your finger right behind your ear, there's like a very, very hard bone. That's what we call the mastoid process. And right behind it is where those suboccipital muscles start to originate. I'm gonna see if I can turn this around so it's less of a bother. From here we place that spoon at the base level, right here, for example. I press down and it's very hard. And I want you to apply pressure in this way across, going all the way to the middle area of the neck. Now we place that spoon again at the base of the ear at the mastoid process. And from there I push and work all that muscle. Let's do 3 more. I place the spoon, apply constant pressure and move it to the center of the spine. The movement is small, but it's very intense. Go deep because it can be extremely pleasant. 1 more, I press in and slide to the midpoint. We can also work it from the bottom up, bending the neck, exposing that suboccipital musculature. The more we extend, the more closed it is. The more we flex, the more open it is. And from here, use our spoon in the same way to work that musculature from the bottom up in a much more localized way with a slightly more demanding technique. Working the whole area from the middle part all the way behind the ear with strokes from bottom to top and always with a neck flexion in such a way that the lower cervical area is well exposed. Now let's try with the other side, okay? Let me change my position a little. Let me move the cable to this side. I take my spoon. Let's remember that back point, if the mic lets me, at ear level, and from here bring that spoon over. Little by little, little by little, little by little, until the center of the spine. Up to there, you'll notice that right here it starts to sink in. That's because there's less muscle. Let's go with the second one. I push, I push, I push, I push, I push, I push up to the middle. Let's do 3 more. Now I'm more centered. I push, I push, I push, I push. That's 3. I have 2 left. I push with that spoon. 4. So last repetition goes behind and reaches the middle level. And if I want to work more on the suboccipital area, I can flex my head by bringing my chin closer to my chest, and from here work on those muscles with my spoon. From bottom to top, 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 from bottom to top. It's normal for the area to get irritated. The skin is going to suffer a little bit. If you see that there's too much friction or that it's very uncomfortable for you, you can just put a little bit of cream on to improve the glide. And you spend about 30 seconds to a minute working on that whole muscle area, which will help relieve the symptoms. Once you've finished, you go back to the original position and check a little bit to see how it feels. Honestly, I feel the back of my head is much looser. Next, we're going to do a really good stretch as well. I'm going to leave this here. Now that we're done with the spoon, let's move on to the stretch. We have 3 sections: spoon massage, stretching, and finally one last strength or muscle work exercise. For that, we're going to stand here facing forward so you can see it properly. I want you to place one hand here at the chin level and the other hand here at the nape of your neck. I'm going to do it the other way around so you can see it better, and the other hand here at the nape of your neck. What I want is for you to push your chin back, pay close attention. I push my chin back, and with the hand on the nape, pull upwards, okay? It's like we want our head to do this, okay? This. My left hand pushes back, my right hand pushes up, and then I bend my head down. This is going to cause a stretch of the entire suboccipital muscle, which is quite pleasant and gives very good results. Let's go for it. I push here with my back hand, pull upwards, and look down, little by little, bringing the head into flexion until I feel a stretch in the suboccipital muscles. We're going to hold for 30 seconds. Let's go for it again. I push, bring the chin up, and look down, flexing and holding the position. Very straight, very upright. Let's count to 30 together. We're at 5. Then 15, 20, 25, and 30. We relax completely, return the head to its initial position. We can do a little trapezius movement. And now we're going to see a little variation, okay? Also very interesting, which focuses more on one side or the other. Basically, it's the same, okay? We pull that chin back, look back. From here, I take my hand, place it at the nape of my neck, and pull upward to stretch that back part. I look down, and from here, look. What I'm going to do is push my chin to the left. And what I'm going to notice is an extreme tightness on the left side of my neck, especially at the suboccipital level. We're in this position, the hands stay fixed, and my left hand pulls my skull outward, producing a rotation, and right there, exactly, I feel a significant stretch. I'm going to hold it for 30 seconds without talking, because if I talk, the tension is lost. Very good. And you can play a little with your hands, moving them lower, higher, more into rotation, or more to the left. Try to find the exact angle where you feel the most tension, right at that spot in the back, at the level of your neck. That's 10. $20. And 30, we relax slowly, return the neck to its initial position, and now we're going to do the same thing, except this time what we're going to do. Instead of tilting the head to the left, we're going to tilt it to the right, so we'll feel the tension on the side. Right side, I'm going to turn a little so you can see it better from both cameras. From here, I move my chin back, lift the nape of my neck up, keep my chin very close to my neck, and from here, this is what I'm going to do. Instead of moving to the left, I move to the right, slowly. Let's switch hands so it can be seen better. Chin back, bend, head up. From here, turn, 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 until you feel tightness on this edge on the right side of your neck, and from there, hold the position. For 30 seconds. That's 10 seconds. 20. And 30. We relax, slowly return that head to the starting position, and face the camera again. Pay close attention. We've done the following: head back, chin. We turn to one side, and then we've turned to the other to work the muscles on both sides. We move our shoulders a little to relax in case any discomfort appears. And I'm sure you're already noticing some feeling of relief in your neck. Let's continue with another massage technique that I forgot to mention earlier, which is the ball technique. Basically, we need to get close to the wall. There we are. Let's bring this camera a little closer with me. We need to get close to the wall. Let's see. There, perfect. And locate that exact point of connection where both the skull and the neck are, that passage between the head and the cervical vertebrae. Use that ball and place it exactly at that point, in that exact spot. Let me show you with the other hand, right where I have the mic. Also, we leave that ball there. We move closer to the wall and rest our head. Let's make sure it's not visible on camera. Let me adjust this a bit here. All right. We place that ball at the level of the wall, rest our head, and let our head fall against the wall, so that the muscles relax through the pressure of that ball, so that little by little, by pushing your head against the ball, it manages to get into the muscles and relax them using a deep massage technique. I recommend doing it on one side, just as I'm saying now. I move my chin back to open up that back area more, and I lean on it for about 30 to 60 seconds. Let's just do 30. So you can see it. Close your eyes and push your head back. If I'm doing the exercise correctly, it's because I'm applying pressure. If I didn't apply pressure, the ball would fall. And after 30 seconds, we switch sides. I locate my right side, right there, where the skull and neck meet. I rest my head to make sure it looks perfect. And from there, I maintain constant pressure. I lean downward to open up that back area, and I hold it there. 30 seconds. We've done 10. 20. And 30. We relax, let the ball drop, and we're done with it. Last strengthening exercise. As I promised you, we've done 3 fundamental pillars: spoon massage, ball massage, stretching, and finally, exercises. Spoon and ball massage. It's a pillar. Exercise is the second one we're going to do now, and finally, stretching, which is the one we did halfway through. You've probably seen the double chin exercise before. I really like doing it, and it's an essential exercise for the health of your neck. Basically, you have to position yourself like this, with the back of your head against a wall, very close. Also, your buttocks sitting on a stool, obviously, so that the backrest doesn't prevent you from getting into position. From here, notice the importance of your chin. I want you to move it back and try to reduce the space that's right here, exactly between your neck and the wall. Holding that position, bringing the nape of your neck upward. It's a bit like what we did earlier with the stretch. Let's hold the position 1, 2, 3, 4, and 5. Relax. This chin goes forward and I come back again. Support head, tuck in the chin, reduce this space that's right here. 2, 3, 4, 5. Relax. That's 2. Let's go again. I push my head upward, reduce this space we have here. 2, 3, 4, 5. Relax. You should feel the work both in your neck and in your upper back. In fact, you're working a lot. Deep muscles at the level of the spine. Let's do 7 more before we finish the video so you can join me. 2, 3, 4, and 5. And relax. You can also place a small towel here just to have a reference and to press down on something when you do the exercise. Let's go again. I push. I relax. We've done 4 or 5. I push. I reduce this space. I hold the contraction. I relax. 6. I push. I relax. 7. We have 3 left. I only push. I relax. 8. I push. 9. Last repetition. I push. And 10. Very good. What did you think? I feel my neck is very different from when I started. The routine or the 3 techniques. Remember that I invite you to Neck Week, an event especially dedicated to the cervical area, where for 7 days I will be live, providing you with a lot of information, exercises, and strategies to improve your quality of life. The best part is that it's a completely free event, and you can join just by leaving your email at the link I've left down here, in the video description, or in the first comment. Thank you from the bottom of my heart for staying until the end of the video. I hope you joined me at home doing some of the exercises and that you can share this with anyone who has neck discomfort and needs a little help to get better. That's all. I say goodbye to you, thanking you once again from the bottom of my heart for staying until the end. I hope to see you very soon next week in another live broadcast. Bye, friends.